Well, I came here because it said what's breaking my heart, and they were talking about having information about um, your heart and a healthy heart or heart conditions, and that intrigued my interest because we've had some issues in our household. With myself, I had a heart attack a couple of years ago, well, about 4 years ago, and my husband had a stroke. So I said I need to get more information about how to be more healthier. Well, my grandmother had high blood pressure, and then she had a stroke, but she passed with a heart attack. Well, she had another stroke, and then it turned into a heart attack, and then which actually was fatal for her. So at that in that one event, that last event. And so that was that. So blood pressure, high blood pressure, and diabetes. My mother had diabetes, and so those were the history of her. But I didn't, when they brought it up today, yesterday, I didn't put it together. I'm like, I need to write this down about. And when I go to the hospital to see my doctor, I need to talk about those issues. I never tell them that. I'm like, wow, I've never put that on the table because my doctor is so doggone long-winded, and I could tell him what's going on with me, but it seems that he has his own thought about it's preconceived notions to me, so I don't really get a chance to talk. But yesterday, as I was in the at the event, I felt empowered. I said, I'm going with my list, and I'm like, I need you to hear me. This is what's hurting, and I need you to understand. Let's talk about that. And I need to tell you some things that's going on with me, and I need you to be quiet first and let me say what I have to say. And so I didn't feel like I had the power to do that because he's the professional. He's a professional, so I felt like, well, I guess he know better than I do, but I realized yesterday, who knows better about what's going on with my body than me, because it's going on with me. And so I felt so empowered that I couldn't wait to get home to talk to my husband. I said, my appointment next time, I'm ready. And we're going to get some things understood. So I began writing my list down. And then when they had the session about your family history, I looked at the paper and I'm like, I know some history already, but I have never considered taking it into the room with my doctor with me. They asked me, but I never said. When you first have your first initial, when you sign up with your doctor, they ask all these different things. I say it, but I never bring it back up, and to the point where it could be something there that could help me now, or could prevent something that could happen. And so now I'm going to be, we have this history in my family. So I feel this right here. I feel this right here. Let's check on that. Let's give me some in-depth diagnosis maybe. I don't know, maybe checking. I don't know how you do that, but I'm going to talk about some stuff. I will be sounding a trumpet. I will be doing that. I've already started. This morning, first I went home and told my husband and got him excited, as excited as I was. He was going to come today, but some things happened that he couldn't come. But I also went to church this morning because we have early rise prayer. And I began to tell him, I went to this event yesterday. I feel so empowered. Do you know that you have the power to talk to your doctor, your physician, and let them know what's going on? And you should be heard. And it's your responsibility to advocate for yourself. You have to be an advocate for yourself. So that means that when they get to talking and telling you this and that and telling you this and that, you have the power to say, wait a minute, hold up. I think we need to go a little bit farther. Let me advocate for myself. Let me talk about what's happening with me.